Namaste, myself Dr. Nirmala Swal from Kathmandu, Nepal. So today I am talking about stress management and hair fall. So generally this hair fall is related with the internal problems like the digestive problems or metabolic problems or any issues with the asthi dhatu, but hair fall is also directly proportional to the stress. So we will know in details about this stress management and hair fall. Does stress cause hair fall? Usually, one may notice hair falling out in excess after 3 to 4 months from the point or the period of a stressful event. Okay, so this can continue for several months if we don't adopt any therapeutic remedies. When we are undergoing any stress-related hair fall, we may set off more than 100 strands in a day. So generally, 50 to 100 strands is a normal phenomena for normal people, but when there is stress related hair fall, so there is hair fall more than 100 strands. So hair thinning or diffuse hair loss and small bald patches on the scalp are the most common signs to identify if we have stress related hair loss. And also we can trace back to check if any stressful event has occurred about 3 to 4 months ago to understand the underlying cause of our hair loss. So here, after reading all this point, we come to know that stress is directly proportional to hair fall, or hair fall is directly proportional to stress. How much we take stress, in that ratio there will be hair loss. So our hair is the byproduct of asthi dhatu. The hair condition is directly affected by the health status of the bone. So when we are stressful, our nervous system releases the cortisol hormones. Even when we take little amount of stress, like meeting deadlines or getting late to an office meeting, we get very stressed, and there will be a release of cortisol hormone, which will increase the stress. So as a result, our body resources are allocated to make more energy available to the brain and large muscles, and this disturbs immune system and digestive function. So in this scenario, the activity of osteoclast increases. This affects body's capacity to maintain the bone health, in turn affecting our hair growth. So let's know more about the stress and hair loss. Anyone, that's men, women, and children, can experience hair loss. Stress-related hair loss. So most people normally say 50 to 100 strands in a day. So since new hair is growing at the same time, it doesn't cause any noticeable thinning of the scalp. So since the hair cycle is going in, like the new hair is growing in, and again the old hair is just taking out, so it shows the thinning. So in that way there will be balance and no one notices the thinning. But here hair loss occurs when this cycle of hair growth and shedding is disrupted, or when the hair follicle is destroyed and replaced with the scar tissue. So in that way we can notice the hair loss. So important thing we need to know over here is hair growth cycle. So stress affects the hair growth cycle very badly. So normally there are 3 phases of hair growth. So the anagen phase, catagen phase, and telogen phase. So the anagen phase, it's a growing phase where the hair follicle is nourished through the blood circulation, which enables the hair growth. So normally this anagen phase, it lasts for 1 year to 6 years. And in second phase, that is catagen phase, that is transition phase. So the hair follicle detaches from nourishing blood supply. So the hair follicle detaches over here, and in this phase normally lasts for 1 to 2 weeks. And in last phase, that is telogen phase, so there won't be any nourishment of hair follicle and the hairs fall out. In this way, this last phase is last for 2 to 4 months, and then the hair is detached and new hair comes back. So normally this cycle, it takes around 2 to 6 years, this whole hair cycle. So this whole hair cycle is disturbed badly by the stress. So the stress affects the anagen phase mainly, that is the active growth phase. So growth phase is affected badly, and then this growth phase is shortened. So the 2 to 6 years is shortened in few months or few years or few weeks. So here, so stress appears to excessively stimulate our androgenic hormones. In times of stress, our hair's anagen phase abruptly shifts to catagen phase. So this growth phase, which lasts for 2 to 6 years, is it shifts to catagen phase. That is one to 2 weeks. This is the transition phase. Normal hair, at least 85% of hair is supposed to be in anagen phase at any point of time, and 1% to catagen phase. So here 85% is supposed to be in anagen phase, but due to this stress, this percentage varies, and most of the hair, the anagen hair, it changes to catagen phase directly. As a last portion of anagen phase hair shifts abruptly to the catagen phase, this ratio is altered in the times of stress. So this causes a sudden loss of much larger amounts of hair. So here, in case of hair cycle, so this anagen phase, which lasts for 2 to 6 years, the active growth phase, it is badly disturbed by the stress, and then it suddenly changes to catagen phase. That is the transition phase where the blood supply, the nutrition supply gets detached, and it's changed to telogen phase. So this big amount of anagen hair changes to catagen phase, and good amount of or big amount of hair loss, hair shedding occurs, which results in big hair loss. So this type of hair loss can be seen through while washing our hairs or while combing the hairs. So let's go in detail. So causes of stress and hair loss. So stress that causes hair loss are just like the low calorie diets. So some people, they may go for some kind of fasting or weight loss journey, then severe chronic diseases, then high fever. So mostly in my clinic, I have found post-COVID patient and post-dengue patient with high fever, and they have severe hair fall, then major surgery, and the surgery related with the carcinoma, severe infection, then the emotional stress. So these are the very effective causes of stress. This type of stress causes the hair loss. So the symptoms include hair loss. Hair loss can occur gradually or all of a sudden. It may affect just the scalp or the whole body. So mainly scalp is seen, but sometimes whole body can also be seen. Different types of stress related hair loss. So different types of hair loss are there, but mainly the stress related hair fall we can see in three different headings. So first one is telogen effluvium. So telogen from the name of the growth phase. So the last phase, the resting phase. So all the hair from anagen and catagen, that changes to telogen phase. That is the resting phase. So in telogen effluvium, a majority of hair follicles enters the resting phase due to stress. After 3 to 4 months in resting phase, the affected hair sets out diffusely while washing or combing. So the mainly a big amount of hair loss can be seen here. Second cause is trichotillomania. So the affected person feels a constant need to pull out the hair. The condition is caused due to stress or any shocking event. Okay. So this is mainly related with the mental stress. And then alopecia areata. So nowadays alopecia areata is very common. So 1 to 2 number of patients visit regularly on regular basis in our OPD with the complaint of with the history of alopecia areata. So stress could be one of the most predominant causes that can trigger autoimmune responses leading to alopecia areata. So is the stress related hair loss permanent? Does the hair loss due to stress grow back? So this is very important question, and most of the patient they do this type of question. So in general, hair fall due to stress is very temporary. Our hair starts to grow back normally a few months after our stress levels are reduced. However, the rate of regrowth differs from person to person depending upon the hair care routine and lifestyle. So I would like to give some Ayurvedic background over here. So how is the dosal distribution in our hair, in our scalp? So this frontal part is the site of Vata. So Vata means, so when people become more stressful, so this is more the lakshana of Vata. So more hair loss from the central area, this frontal area, and then um, loss of sleep due to stress or too much activity that causes the loss of frontal hair. So this sideline hair, this forehead, and this frontal area baldness is due to the imbalance of vata or overactivity of vata. Then secondly, crown hair or parietal area. So this is the site of pitta. So this hair fall is seen due to the pitta imbalance. So just like the balance, just like the hormonal issues, or just like the heat issues, or just like the digestion and metabolism issues. So the hair fall is seen due to the digestion, metabolism, or any kind of pitta imbalances. So this is the mainly the crown area or this cortex area. So this is common mainly in the in the middle age group people, so from 20 to 40. So this crown area is very difficult to treat, so it's very difficult to grow new hair over the crown area. Then the occipital area, the back area. So this back area is the site of kapha hair. So hair is formed by kapha energy over here. So being the building block of the hair. So normally the occipital hair area doesn't grow fall out. So many patient they complains about they fall over the frontal area, crown area, but only very few only very few patients complain about the hair fall over the occipital area, or there should be any pathological condition. So what should be the treatment approach? So medical treatment, the main medical treatment, the very important medical treatment is the stress management. Stress management should be done. So here, in case of medical treatment, the first priority is stress management. When the hair patient visits, from the day 1 to day last, we need to give any medicine regarding the stress. So just like some methodologies can be used, Brahmi, Jatamasi, Vacha, Sankapushpi, Estimadu, or some medicine can be prescribed like the Sarsotarista, Manasmitra Botek, Ashwagandha. So in my practice, I mostly use Sarsotarista, and it is giving very good result. And in many of the patients, just like the hair patient, mostly 90% of the hair patient they are smokers. So what I have observed that the smoking rate also has been decreased due to the use of Sarsotarista. So smoking is also due to stress level in male patient. So Sarsotarista it plays very important role in quitting the smoking. So this stress management should be done from the day 1 until the treatment finish. Okay. Then Pitta Samuk Chikitsa, so Pitta being the main, Pitta plays the main role in Samprapti. So Pitta Samuk Chikitsa should be done, and Pitta controls the digestion, metabolism, and hair and skin. So Pitta plays the main function. So Pitta Samuk Chikitsa should be done. Then Ampachan, Vatan, Loman Chikitsa, Sotas Chikitsa, Dhatu Chikitsa, and Rasayan Chikitsa should be done. Then some external therapy should be done. So Samanya Kesa Panchakarma should be done. So zero opening the head massage should be done. Then the Parishek is the showering by the herbal decoction. So by the use of different varieties of herbs according to the condition of the hair. So if there is too much dandruff, then we can make the decoction from neem, from taturpatra, from trifala, chandana. We can use for Pariseka. Then Sirodhara. So mainly in Sirodhara we use the Brahmi oil or Guduchi oil, or any oil can be used according to the condition. Then Takradara, so Takradara is very effective in stress management and for the dandruff condition also. Then Nasya should be done. So Nasya is considered to be one of the best therapy for hair fall, for graying, and for stress also. So Nasya can be done. So here we can use the Bringaras, Suras, or we can use the Amutail Nasya. Or different types of oil can be taken. Then Zero Pichu should be done. Zero Lepo can be done. So about the Panchakarma, so woman can be done, and the best will be the Birejan. So Birejan should be done for every hair and skin patient. That means for every pitta related diseases, Birejan should be done. Then Nasya should be done. Roktamokshan by the use of the leech therapy, coping therapy should be done, and Roktamokshan by the process of taking out the blood from the cuboidal vein. Also, it also helps, and we can. So this Roktamokshan plays very important role. Roktamokshan also plays role to purify the blood. Not only that, it also helps to reduce the stress. And then Vasti, so Tiktachir Vasti is considered to be one of the best therapy, miraculous therapy for the hair fall patient. Then in case of external therapy, so recent therapy which is very common nowadays, so mainly the Kurcha Chikitsa. So Kurcha Chikitsa is it creates microbleeding and stimulates collagen remodeling. So this is very one of the miraculous therapy of ancient Ayurveda. Then Prathana Karma can be done. So blood will be taken out by piercing a small size needle, and then labor chikitsa should be done. So different types of labor like the gunja seed labor, or the Triphala neem labor can be applied, and then Jepal lab can be applied. So these are very so after applying the labor, we can observe new hair sprouts being grown out while doing the trichoscopic examination. Then cupping can be done. So cupping over the hair can be done. Then leech application can be done. So leech application is one of the best therapy for the hair patient. And then for instant hair management, Ayurvedic hair spa can be done. So mainly the Shiro Obenga. So while doing the Shiro Obenga, some murmur of the Shiro like the Sthapani Adipati murmur that should be addressed, and proper pressure should be given. So different types of oil like the Mahapringaras oil, Brahmi oil, or Durpatradi oil, or Nilbringadi oil, Nalpramadi oil. So that type of oil can be given, but while doing this Shirodhara, we should be very careful. So first we need to do trichoscopic examination. If there is wet type of dandruff, then too much use of oil should not be done, because it again increases the dandruff. So we should be very careful about doing Shirodhara. Then Siropichu should be done. So Siropichu is very effective for instant hair loss management. So a cotton gauze, a cotton pad, which will be packed by cotton gauze. So it should be deep into warm medicated oil, and then it can be put over the vertex crown area for a certain period of time. It will help to manage the instant hair loss. Okay, and then scientific combing. So this is the proper way of combing our hair. Hair combing should be also done. So most of the patient who are in stress, they don't care about taking care of themselves and taking care of their hair also. So they should be doing proper care of their hair. So proper combing should be done. So preferable will be the neem comb or the bamboo comb. So that type of comb should be used, and then Shirosvedana should be done. So for Shirosvedana, the decoction of Triphala neem will be very wonderful. Then Thalam process, so application of warm medicated paste over the vertex area for the certain period of time. So the herbs will be according to the necessity. Then tala process can be done, kesa dhupana process. So this is very interesting therapy. So here we can use the bringraj, neem or triphala, so raw triphala that can be used and can be given dhupan. Then kesa prakshalan. So kesa prakshalan by the decoction of triphala and yesti madhu, so that gives a very wonderful results. So this therapy can be done to manage the instant hair loss in the patient of stress. And blood investigation should be sent, some blood investigation, so CBC to test the level of the to check the level of hemoglobin, blood sugar, then serum calcium, serum ferritin, vitamin B12 and vitamin D, testosterone and TFT be sent. Then effective stress relieving Ayurvedic therapy, that can be prescribed like the Svetana, which is the herbal steam therapy to loosen the toxin build up in our body. Then Ofinga for the complete rejuvenation. Then Pichil, that is the oil bathing. Then Sirodhara, so Sirodhara can be done, which is considered to be one of the best distressing therapy. Then Shirovasti can be done, Talam process and Talam Podichil process can be done. Then there should be some changes in Ayurvedic lifestyle, like the mainly the sleep. So sleep should be adequate, like the 6 to 8 hours. And another thing, so in our samhitas it is written early to bed and early to rise. So we should try to sleep at 9 p.m. or 10 p.m. So 12 a.m. or 1 a.m. is not the good time to sleep. So we need to sleep on the same day and we need to wake up on another new day. So this should be the principle. So nowadays, after the COVID, people's lifestyle has changed. So most of the male patients, they just spend more time in the mobile. Some people they have to do their job, and some people they mostly play games, video games in the mobile. So and they sleep very late. So this type of patient, they have mainly the frontal hair fall. So mainly the side hair fall can be seen. So adequate sleep should be maintained. Then one should be very happy, laughing should be done. So laughing is best medicine here, so it will help to feel light and reduces our anxiety. So laughing decreases the cortisol levels and releases endorphin. So laughing should be practiced from time to time. Then we need to slow down our lifestyle a bit, and then exercising and doing yoga is very effective to relieve the mental and physical stress. So yoga helps greatly in reducing anxiety, stress and depression. Then meditation, which is very best, which is the one of the best tool for our mental harmony. So it should be practiced. Then in case of diet, so diet from stress point of view, so we need to take healthy, nutritious, balanced diet. Protein rich food will help to prevent hair falls and baldness. So mainly the food like the egg, beans, fish, low fat cheese, that should be taken. Then increase the intake of iron, and then increase intake of resins, that should be done. Then food responsible for thinning of hair should be avoided, like the excessive oily, spicy, sugary junk food should be avoided. Caffeine, carbonated taking drinks should be avoided. Then so this is the special chart for the hair food. So in case of vegetables, so regular intake of soya, rajma and lentils, beans should be taken. Non-veg proteins are very important. So then intake of eggs and chicken, it's very important, so it should be done according to the requirement. Then consumption of the saturated and unsaturated fat, and then special superfood is there. So so the equal amount of sunflower seed, flax seed, watermelon seed, pumpkin seed and black sesame seed, so that should be roasted properly, and then it should be mixed in a jar and taken 1 teaspoonful in the morning and in the morning and in the evening. Then multivitamin supplements, especially vitamin B12, B6 for hair growth, vitamin C for the sebum production, and vitamin E for maintaining the scalp health, so it should be taken. And some mineral rich food should be taken. So iron and folic acid, it gives nutrition to the hair. Copper gives color. Then zinc for the scalp and hair follicles. So for zinc we can take the Gokchul product, Gokchul Chuna. Then for copper we have Tamra Basma, okay. And then for iron and folic acid we have Low Basma and Blasam. That should be taken according to the requirement. Then daily intake of milk is required, which is the complete food. And then the dry food should be taken. Different antioxidant can be taken. So there should be change. There should be some changes in Bihar. Okay, the lifestyle. So we can reduce stress, anxiety through pranayama and yoga exercise. Then deep relaxation using savasana, yoga nidra is very required. Then hair washing should be done from time to time with amla, sikakai or simple herbal shampoos. Hair loss can be prevented by oiling and massaging the scalp. So and then regular bowel movement is very necessary. Then increase in blood circulation and activation of sebaceous gland can be obtained by rubbing the scalp. So this type of activity should be done. So this type of changes, positive changes should be done in our lifestyle. So here now I'm presenting some of the cases. This is the 46 years old female. This is the her picture after COVID. So she got severely affected by the COVID and she had telogen effluvium. So diffuse hair loss. So here in February 2022, so you can see I have applied the leeches. So after that you can see the result of March, May, and in June her hair is full of hair. So this was the change. Okay. So this is the male patient. This is the 38 years old male patient. This hair was affected due to the COVID time. COVID affected patient. So he had very too much shedding of hair, and now before and after you can see the result. Okay? So this is the case of alopecia areata, the autoimmune disease. So the before picture you can see some round patches over the whole head. So this is due to stress mainly. So he is going some mental depression, and this patient is taking medicine for that, and he got this alopecia areata. So now you can see the changes. Here is growing from inside. So the same patient, the round patches can be seen. So new hair grow can be seen over here. And then this is the case of alopecia universalis. So there is shading of these eyebrows. So here in after picture, in next photo you can see the new a new hair grow in the eyebrow area. So this is all about the stress and hair fall. Thank you so much for your time. Thank you so much for having me here in this most prestigious platform of Ayurveda. Thank you.